Welcome to the 2024 Annual Commissioner Training provided by the Mississippi Department of Mental Health. My name is Wendy Bailey, Executive Director of the Mississippi Department of Mental Health. We continue to focus on community-based mental health services for adults and children and youth to prevent unnecessary hospitalizations. This training will walk you through the state's mental health system, the different service areas, programs that are directly operated by the state, the crisis continuum of care, significant legislation that has been passed, and some essential resources that should help you as a commissioner in your role. Over the past several years, many services and supports have been expanded and new ones implemented, including mobile crisis response teams, community transition homes, crisis stabilization beds, PAC teams and I-Court teams, supported employment, supported housing, court liaisons, crisis intervention teams, and much more. This progress has been accomplished through the partnership between the Department of Mental Health and community mental health centers across the state. We continue to believe that issues take everyone at the table for effective solutions, not just state leaders, but county leaders, law enforcement, and the voices of people needing the services. In addition to legislation, we continue to encourage conversations between county leaders, local mental health authorities, and other providers of inpatient psychiatric services and community services, whether those be public or private, to develop solutions to the issues that communities are experiencing. Conversations have already occurred and are still occurring that have led to additional court liaisons, additional crisis stabilization beds and technical assistance, new peer respite sites exploring diversion centers, additional training for mobile crisis response teams, a bed registry for chancery clerks to utilize, and much more. We encourage you to take advantage of this training, and if you have additional questions, do not hesitate to reach out to the Mississippi Department of Mental Health or to your local community mental health center. Mississippi's mental health service delivery system is comprised of three major components. The first component is state-operated programs and community service programs. The second component is regional community mental health centers. And the third component is other nonprofit, for-profit service agencies and organizations. There are three service areas that fall under the Mississippi Department of Mental Health and the state's mental health system. Those include mental health, intellectual and developmental disabilities, and substance use. DMH provides hope by supporting a continuum of care for people with mental illness, alcohol and drug addiction, and intellectual and developmental disabilities. Services are provided in those three areas. The goal of the service system is to have a full continuum of care for people in need of any of these service areas. DMH believes that community-based services and supports that meet the particular needs of the person should be available and accessible in the community. As the state mental health authority, the Mississippi Department of Mental Health is responsible for the administration and monitoring of more than 650 grants for adults and children and youth with serious mental illness, substance use, and IDD. Certification and monitoring of 128 providers across the state. On any given day, there are about 950 people receiving services at the 4 state hospitals, including all services that provide 24/7 support. On any given day, there are 1,200 or more people at the IDD regional programs and community homes across the state, and more than 2,700 people being served through the IDDD home and community-based waiver, and another 1,100 being served through the 1915I Community Support Program. The department is also responsible for the credentialing of more than 3,500 staff in the state's mental health system. Again, in Mississippi, the Mississippi Department of Mental Health is responsible for the provision of services in all three of the service areas: mental health, intellectual and developmental disabilities, and substance use services, including both prevention and treatment. In 39 states, there is a responsibility for both mental health and substance use services are combined into a single agency. Mental health and substance use disorder services are located within the same state umbrella agency in 7 additional states. Most, but not all states, have combined mental health and substance use into a single behavioral health agency, and they've also combined planning, data systems, financing, and licensing for mental health and substance use disorder. 10 states, Mississippi being included, are responsible for all 3 service areas: mental health, substance use disorder, and ID/DD services being combined into one agency. In 2023, states operated 182 psychiatric hospitals and served more than 40,000 patients on the first day of their reporting year. In 13 states, the responsibility for the operation of state psychiatric hospitals do not fall under the authority of the State Mental Health Authority. Rather, a different division of state government operates state psychiatric hospitals, while the State Mental Health Authority is responsible for community mental health services. The Mississippi Department of Mental Health is responsible for operating 4 state hospitals: East Mississippi State Hospital in Meridian, which has 120 acute psychiatric beds, a substance use disorder unit for males, and a nursing home; North Mississippi State Hospital in Tupelo, which has 50 acute psychiatric beds; South Mississippi State Hospital in Purvis, which has 50 acute psychiatric beds; Mississippi State Hospital in Rankin County, which has 100 acute psychiatric beds, child and adolescent beds, a nursing home, forensic services, and continued treatment services. It also offers adolescent services for substance use disorder as well. Under the umbrella of Mississippi State Hospital is the Specialized Treatment Facility, which is a psychiatric residential treatment facility in Gulfport, which has 32 beds. In FY24, there were 1,897 acute psychiatric admissions to the 4 state hospitals, and 2,277 people received acute psychiatric services. There were 672 people served for substance use disorder at the 2 state hospitals, East Mississippi State Hospital and Mississippi State Hospital, and 239 children and adolescents that were served at Mississippi State Hospital. Through the nursing homes at East Mississippi State Hospital and Mississippi State Hospital, there were 353 people served, and 122 people received forensic services at Mississippi State Hospital. The state hospitals partner with the local community mental health centers for transition planning for when a person is discharged from the hospital to receive the needed services and supports in the community for them to be successful and to prevent readmission to the state hospital. Mississippi State Hospital operates 25 substance use disorder beds for female, and East Mississippi State Hospital operates 35 substance use beds for males. Wait times for these services has decreased in recent years, and the hospitals have transitioned to providing services for females at Mississippi State Hospital and males at East Mississippi State Hospital. In FY24, the wait time for substance use disorders as Mississippi State Hospital was approximately 6 days, and the wait time for substance use disorders for males at East Mississippi State Hospital was 7 days. The 1,897 admissions to the state hospitals in FY24 is a decrease of approximately 4% from the previous year. The Mississippi Department of Mental Health is also responsible for state-operated programs for intellectual and developmental disabilities. IDD regional programs provide 24/7 residential services, both institutional and community services, for people living with an intellectual or developmental disability. Programs are licensed as intermediate care facilities, and in addition, there are 61 community homes across the state operated by the IDDD regional programs. Boswell Regional Center is located in McGee, and under its umbrella is the Mississippi Adolescent Center in Brookhaven. Ellisville State School is located in Ellisville, and under its umbrella is South Mississippi Regional Center in Long Beach. Hudspeth Regional Center is located in Rankin County, and North Mississippi Regional Center is located in Oxford. In FY24, there were 690 people who received services at the ICF IID regional programs on campus, and 504 people who were served in the community homes across the state. The IDDD home and community-based waiver served approximately 2,868 people in FY24. Without these services, many of these people would have been required to receive services in a higher level of care, such as institutionalization. The IDD Community Support Program, the 1915I, served 1,150 people across the state in FY24. Community mental health centers operate under the supervision of regional commissions appointed by county boards of supervisors from their respective areas. There are 11 community mental health center regions across the state. The Department of Mental Health establishes minimum standards for certifying and monitoring the community mental health centers. Community mental health centers are required to provide core services for adult mental health services, children and youth mental health services, substance use disorder services, and intellectual and/or developmental disability services. Additional services such as crisis stabilization beds, mobile crisis response teams, assertive community treatment, intensive outreach and recovery teams, supported employment, and much more are also available at the community mental health centers. In FY24, more than 74,000 people were served by the community mental health centers across the state. State mental health authorities vary by the methods they use to coordinate and distribute community mental health center resources across the nation. There are 3 major methods used by state mental health authorities to provide community mental health services. 42 state mental health authorities directly contract with local, usually not-for-profit, community-based mental health providers, and 30 state mental health authorities primarily fund local community-based providers. 22 state mental health authorities fund local government mental health authorities such as city, county, or multi-county, which in turn operate and contract for mental health services. 16 state mental health authorities primarily fund community mental health services through local government. And 13 state mental health authorities provide community mental health services via state-operated community providers. 6 state mental health authorities primarily directly operate community mental health services with state-operated providers, as you can see on this slide. In Mississippi, the Department of Mental Health provides funding directly to the community mental health centers, which are part of local county government, for specified services and supports. In FY24, there was more than $85 million allocated to the 11 community mental health centers for all 3 of the service areas. And also in FY24, there was $19.9 million allocated in ARPA funding, which is temporary, to the community mental health centers. DMH certified providers play a crucial role in building out the public mental health system by directly delivering mental health services to the community, providing specialized expertise, and increasing access to available services and treatment options. DMH is responsible for developing and managing the application, certification, and compliance processes for providers seeking to obtain and maintain DMH provider certification. The Department of Mental Health currently certifies 128 providers in Mississippi, including the 11 community mental health centers. 71 certified providers reported the use of more than 182 evidence-based and best practices.
We will now take a look at some data both in the United States and in Mississippi. My name is Katie Storr, and I am the Chief of Staff with the Department of Mental Health. It's important to talk about what's happening nationally in behavioral health as it provides a benchmark for comparison to our state, highlighting areas where we are performing well or need additional support, and allowing for more informed policy decisions. Some key findings from the 2024 Mental Health America State of Mental Health in America report are that 23% of adults experienced a mental illness in the past year, which is equivalent to nearly 60 million Americans. 13% of youth ages 12 to 17 reported experiencing serious thoughts of suicide. More than 5% of the U.S. adult population, or 12.8 million people, reported experiencing serious thoughts of suicide. 1 in 5 youth had at least one major depressive episode in the past year, and over half of them, nearly 3 million youth, did not receive treatment. 18% of adults in the United States had a substance use disorder in the past year, and 77% of them did not receive treatment. In Mississippi, 431,000 adults have a mental health condition. Of those, 120,000 adults have a serious mental illness. In our state, we lost 421 lives to suicide, and 107,000 adults had thoughts of suicide in the last year. There were 27,000 Mississippians aged 12 to 17 who have depression. The State of Mental Health in America report ranks all 50 states and the District of Columbia based on 15 mental health access and prevalence measures. In the 2024 report, which uses 2022 data, Mississippi has an overall ranking of 34. Our adult ranking is 45th, youth 18th, access to care is 50th, and mental health workforce availability 42nd. There has been a large focus in both the state and the nation on the behavioral health workforce because of the declining number of people working in this field and the difficulties with recruitment and retention. The United States is experiencing increased levels of unmet behavioral health needs among people of all ages. The capacity of the behavioral health workforce to meet the demand of people who need the services is limited by supply and distribution challenges. However, the challenges facing the workforce extend beyond just supply and demand issues. It is projected in 2036 a substantial shortage across the nation of addiction counselors, marriage and family therapists, mental health counselors, psychologists, and psychiatrists. Some of the challenges among this population include population demographics. Since 2011, and due to the pandemic, the need of people and the acuity of the needs of the people receiving mental health services has been on the rise. Scopes of practice, there are inconsistent scopes of practice which make it more difficult for clinicians to move to and practice in different states and provide telehealth across state lines. The cost and reimbursement and insurance coverage, retention among this population. Turnover rates among behavioral health workforce are believed to be some of the highest in the nation and even higher in rural areas. There are low wages, restrictive and inconsistent scopes of practice, and people are left with large workloads and caseloads, which then leads to burnout. The state will continue to focus on these challenges and the workforce, developing initiatives to improve recruitment and retention. In the National Research Institute's 2022 Workforce Shortages Report, which focuses on both community service providers and state-operated programs, it found that shortages exist in a variety of settings across the continuum of care, and that shortages vary across different service settings. Of all of the states who reported, all reported experiencing some form of a workforce shortage. 98% of reporting states have a nursing shortage, and 93% of reporting states have shortages in state hospitals and residential treatment centers. Some of the initiatives that we have undertaken in Mississippi to tackle the behavioral health workforce challenge is the reconvening of the Workforce Development Committee with a renewed focus on the public mental health workforce, and in particular, the community mental health centers. This committee will work to activate strategies to increase the workforce capacity and receive technical assistance from the National Association of State Health Policy. We are participating in National Academy for State Health Policy Behavioral Health Workforce Policy Academy, partnering with the Mississippi Community College Board to determine which programs can and should be implemented to increase behavioral health staff in our public mental health system, advocating for policies and legislation to support the public behavioral health workforce. The agency provided ARPA funding to the community mental health centers to support the mobile crisis response team workforce. The agency recently reviewed and revised our operational standards, which focused on staffing expectations, supporting and embracing peer support specialists into the public behavioral health workforce, and supporting services that provide access to behavioral health help, such as 988, and also increasing telehealth access and utilization where appropriate.
We will be briefly discussing 5 pieces of legislation that was passed during the 2023 and/or the 2024 legislative session. The Mississippi legislature has been focused on supporting, improving, and implementing policies and programs to enhance services and supports for mental health, substance use disorders, and intellectual and developmental disabilities. We'll look at a few updates to some of these key bills that were passed over the past 2 sessions. All admissions to the Mississippi Department of Mental Health state hospitals are handled through the court commitment process. This process was significantly revised during the 2024 legislative session. Individuals are admitted to state behavioral health programs through commitment, which is a legal process in which a court orders a person to a hospital for evaluation and/or treatment. State law also allows for commitment specifically for alcohol or drug addiction, including orders for outpatient treatment as an alternative to inpatient treatment. Mississippi law also allows a medical professional to initiate a 72-hour hold for an individual without the need for a warrant or court order if there is reason to believe that the person may harm themselves or others. Someone may be held in a hospital, CSU, or other medical facility. If necessary, an involuntary commitment may be sought by the court after the expiration of the 72 hours. This slide represents the previous timeline for the Mississippi civil commitment process prior to it changing in legislation effective July 1st, 2024. As you can see, previously an affidavit was filed with the county clerk, followed by a writ being issued to take the person into custody for pre-evaluation screening and treatment, followed by a pre-evaluation screening and treatment to see if the person meets civil commitment criteria. Within 48 hours, if further examination is recommended, healthcare professionals appointed by the court examine the person. Followed by a hearing within 7 to 10 days. The judge decides whether treatment in a state behavioral health program or outpatient program is necessary and issues a commitment order if so. The person then is civilly committed to the least restrictive treatment that can meet the person's treatment needs. And then within 3 months, an initial commitment cannot exceed. This slide represents the current civil commitment process, which began July 1st, 2024. As you can see, the previous third step, which was the pre-screening, has been moved now to the first step in the process. The affidavit will be filed if the pre-affidavit screener makes that recommendation, followed by an affidavit and then a writ being issued, the examination, and then the hearing time has changed as well. Now, within 3 to 5 days, as opposed to 7 to 10 days, after the final examination, a judge decides whether treatment in a state behavioral health program or outpatient program is necessary and issues a commitment order if so. This civil commitment process was changed in House Bill 1640. Previously, if someone needed to seek civil commitment for acute psychiatric services, they started at the Chancery Clerk's office, and then an affidavit was filed and a writ was issued. Following the writ, the person was many times picked up by law enforcement for a pre-screening to determine if they met commitment criteria, and then 2 examinations would occur. Many times, while this is occurring, the person was held in jail because the person had been picked up on a writ before they had been seen by a mental health professional. House Bill 1640 changed the process and moved the screening to the beginning or the first step. It connects the person and/or family to the community mental health center for a pre-affidavit screening in order to enhance the diversion process and allow for other options for treatment, such as a crisis stabilization bed or follow-up appointment or medication adjustment before the courts and law enforcement become involved. It also requires the affidavit to specifically state that a less restrictive alternative treatment was considered, and specifically why treatment less restrictive than involuntary commitment is not appropriate. The goal is for this connection to occur through the Chancery Clerk connecting the person to their local mental health center by calling the Community Mental Health Center or the Mobile Crisis Response Team, through 988 referrals, through DMH helpline referrals, and through website and social media. The pre-affidavit screening must be completed within 24 hours of the Community Mental Health Center being notified. This can be done by mobile crisis response teams for those who cannot come to the Community Mental Health Center. There is also a safety valve if someone is too violent or if the person refuses to be screened. Then the affidavit can be filed and the process continues. This ensures the person's rights are not violated and gives them the opportunity to see a mental health professional for a pre-screening when possible before law enforcement is involved. This is not to require families to have to take extra steps to get treatment for a loved one. This is to make sure that the loved one is not being picked up by law enforcement on a writ and placed in a police car unless it is necessary. It provides the family and, most importantly, the person with diversion options by making sure they are connected with their local mental health authority first. If a commitment is not recommended, the screener provides the person with connection to other alternative services and resources available and offered, if appropriate. This way, the person is still connected to resources when appropriate. House Bill 1640 also addresses people waiting in jail. A jail cannot be used to hold someone unless the Community Mental Health Center has explored and exhausted all other options, including their crisis stabilization unit, other crisis stabilization units, hospitals, and other options. In addition, the chancellor must authorize the jail hold, and the person must be actively violent. A person cannot remain in jail for longer than 24 hours, and the community mental health center must provide treatment during this time frame while pending placement at an appropriate facility. An additional 24 hours can be requested by the community mental health center and must be approved by the chancellor. House Bill 1640 also allows transportation inside or outside the county for a person to have access to the treatment they need if they are waiting on a bed related to civil commitment. The state now has 204 crisis stabilization beds throughout the state. Many times, if a bed is not available in one region, there may be a vacant bed in another region. This legislation clears up that transportation can occur outside the county. Chancery clerks and community mental health centers can see where CSU beds are available through the bed registry, which is updated daily. House Bill 1640 also addresses the time frame for a hearing. Law currently requires a hearing to be held within 3 to 5 days, with the exception when requested for up to 10 days. House Bill 1640 also requires the Department of Mental Health to provide annual training to Chancery and Circuit clerks to inform them about civil commitment procedures. House Bill 1640 is making a positive impact on the civil commitment process. In July of 2023, there were 78 admissions to the state hospital from people waiting in jail, and the average wait time in jail once DMH receives the commitment was 3 days. Compared to July of 2024, the first month after House Bill 1640 went into effect, there were 38 admissions to the state hospitals from people waiting in jail, and the average wait time in jail once DMH received the commitment was 1.5 days. In August of 2023, there were 86 admissions to the state hospital from people waiting in jail, and the average wait time was 3 days. Compared to August 2024, 2 months after House Bill 1640 went into effect, and there were 31 admissions to the state hospitals from people waiting in jail, and the average wait time in jail once DMH received the commitment had dropped to less than a day. Combining the 2 months in 2023 compared to the 2 months in 2024, that is a 58% decrease in the number of admissions coming to the state hospitals from jails, and a 60% decrease in the wait time in jail from when the state hospital receives the commitment. This doesn't even take into account the number of people being diverted by the community mental health centers through crisis stabilization units, mobile crisis response teams, court liaisons, and more. House Bill 1088 allows a circuit court to retain jurisdiction and proceed with civil commitment in certain circumstances. The order of the circuit court finding that the person is incompetent to stand trial and is not restorable to competency in the foreseeable future shall be in lieu of the affidavit for civil commitment. A circuit court commitment flowchart as well as a civil commitment flowchart is available on the Mississippi Department of Mental Health's website. In 2023, House Bill 1222 was passed by the Mississippi legislature. The legislation included several components, including the Court Liaison Program. Goals of the Court Liaison Program are to reduce the number of involuntary commitments to state hospitals, reduce the amount of time and exposure people have with law enforcement and the criminal justice system, increase the knowledge and usage of community-based services, and increase collaboration with families, court personnel, law enforcement, and hospitals on behalf of the community mental health centers and the people they serve. In FY24, court liaisons employed by the community mental health centers conducted 1,130 assessment interviews across the state and diverted 654 people from placement under a writ or involuntary commitment for a diversion rate of approximately 58%. DMH is funding 33 court liaison positions at community mental health centers statewide. House Bill 1640 also highlights the importance of law enforcement training. The legislation requires mental health first aid for public safety for all municipal and county law enforcement personnel by 2031. Mental health first aid for public safety is an 8-hour training provided by the Department of Mental Health, Community Mental Health Center, and other providers across the state. In FY24, there were 25 trainings held for public safety and 404 law enforcement officers trained. It has also been approved for law enforcement continuing education. House Bill 1222 also addresses crisis intervention team training, which is a 40-hour training. All municipal and county law enforcement entities must have at least one CIT trained officer by July 1st, 2025. It is a 40-hour training, and there were 22 CIT trainings held in FY24 with more than 300 officers trained.
House Bill 231 of the 2023 legislative session directed the department to implement a statewide fentanyl and drug abuse education program. The program is to be designed to be evidence-based, utilizing scientific data and research proven to be effective. The agency received $1 million in funding for this initiative, and it's allocated through Senate Bill 3025 from the Healthcare Expendable Fund. Some other key components of the legislation include a media campaign, local community programs that are established to engage community organizations in tailored education, prevention, and cessation efforts, cessation programs being implemented, and then a surveillance and evaluation system to monitor program accountability and results. In partnership with the Mississippi Public Health Institute and the House Bill 231 Task Force, a combination of two curricula have been selected, Birdie Light and Positive Action. These two programs are being piloted in several schools across the state, including Madison County, Meridian Public Schools, and the Mississippi Band of Choctaw Indians Tribal Schools. The department created an impact report to summarize the state's achievements and the impact of its work. The document is used to describe why our efforts and outcomes are relevant and important. This Mississippi Behavioral Health and IDD Fiscal Year 2024 Impact Report can be found on our agency's website at www.dmh.ms.gov. We encourage you to pull the report up and take a look. The work that's done by our state and community providers are making a difference statewide. We continue to promote and connect the pieces of our crisis continuum here in the state. When a person is experiencing a behavioral health crisis, whether that person has a serious mental illness or an intellectual or developmental disability, an adult or youth, they need to be able to access our crisis continuum. That person needs someone to talk to. They might need someone to respond, possibly somewhere to go, and then someone to follow up. In our state, we have 988 as our someone to talk to. It is a 3-digit behavioral health crisis and suicide prevention line. During the last fiscal year, we received 15,467 calls to one of our 2 988 centers here in the state, and we continue to maintain one of the highest in-state answer rates in the nation. You can also text or chat with 988 when in need. If you text 988, that call could go to one of our 2 Mississippi-based centers, or that text could go to one of the national backup centers. We are working on expanding capacity for our Mississippi-based 988 centers to be able to answer texts 24/7 in the same manner they answer calls. Someone to respond. Each community mental health center has a mobile crisis response team. These mobile crisis response teams respond to the person in crisis, meeting them where they are 24 hours a day, 7 days a week. During the last fiscal year, we received 7,830 calls to mobile crisis teams, and 2,711 face-to-face responses were performed. Somewhere to go. Crisis stabilization units. These offer short-term crisis stabilization to people who are experiencing behavioral health crisis, and it can be voluntary or involuntary. During the previous fiscal year, there were 3,873 admissions with a 93% diversion rate from state hospitals. There's also diversion centers that we're working on, which will offer less than 24-hour stays for crisis respite, and then peer respite. We have opened the first Mental Health Association of South Mississippi's Peer Respite Center on the Gulf Coast. This is a new program offered to Mississippi residents 18 years or older. It offers a haven for connection, personal growth, and holistic well-being, and it is staffed by certified peer support specialists, providing that lived experience piece to people experiencing a crisis, and it's open 24/7. And then, of course, someone to follow up and make sure that people are okay after their crisis. It's important that people know about the services that are available in the state. Over the past 12 months, we've been engaged in a billboard campaign promoting 988 statewide. So hopefully you've seen a billboard such as this one or a similar one, informing people about what 988 is and letting them know that it is available. The department recently published a 988 School Resource Guide. This is a comprehensive document with information targeted for school personnel throughout our state. It offers information on trainings that are available, suicide prevention strategies, postvention. It has information that's targeted for different age populations, so for elementary aged children, middle and high school, and then college. Through a partnership with the Department of Education, this booklet has been distributed to all school districts throughout the state. It is published on the Department of Mental Health's website and is a very valuable resource. And just a few quick updates with some of the activities that the department has been engaged in the past year that you may be interested in knowing about. The agency has revised the operational standards with an effective date of November 1st, 2024. The department is responsible for supervising, coordinating, and establishing standards for all operations and activities of the state related to mental health and providing mental health services, as well as certifying and coordinating of operational standards for the regional mental health and intellectual developmental disability commissions. As part of the standards revisions, we have done this over multiple years, looking at the different sections to make this huge revision. And they have been published for 2 rounds of public comment. Feedback has been sought and incorporated from multiple stakeholders. And then the final version was approved by the Board of Mental Health and Secretary of State. The agency is now reviewing policies and procedures that are in need of revision to be updated with our new standards, and will provide technical assistance to our certified providers as needed. Another change is we have created the Division of Risk Management. This division will identify, assess, and analyze healthcare practices and risk factors to avoid potential harm to individuals served. They're going to coordinate with our Office of Consumer Supports to investigate allegations that could result in abuse, neglect, exploitation, and our other allegations rising to the need for a risk management investigation. Another change is that in addition to our toll-free helpline, the grievance and complaint process has been formalized with the addition of a complaint and grievance form, both available on our website. And then to end, certification site visits and fidelity review site visits. These are going to resume in April 2025 and fidelity reviews in July 2025. This will give the community mental health centers time to review the new standards and update policies and procedures as they need. Beginning in January 2025, certification team members will work alongside their programmatic counterparts to develop and conduct site visits that incorporate all metrics reviewed by DMH. Team members have been using the remainder of fiscal year 2024 throughout the end of the fiscal year to build out this new process. As a reminder, commissioners are required to participate in an annual training, which is what you are viewing now, and new commissioners are required to participate in new commissioner orientation. This training has recently been updated and it's available on our website. If you need the link to the new commissioner orientation training, please let us know. Each year, the Department of Mental Health will conduct annual training. We typically have done this at the annual MHIDD conference and recorded the training to present to those who were unable to attend. So be on the lookout for this training around October, November, December of each year.
On behalf of the Mississippi Department of Mental Health, we thank you for participating in the 2024 Annual Commissioner Training. As Henry Ford said, coming together is a beginning, keeping together is progress, and working together is a success. For the citizens of our state, it is essential that the Mississippi Department of Mental Health, community mental health centers, and providers across the state come together, stay together, and work together to benefit the citizens that we all serve.